Now, as it pertains to bone, that's sort of a longer story, which is that when we think about bone loss as we age, now we let me start by saying a little bit about sort of the what bone health looks like throughout our life. We rapidly gain bone during our adolescence, and then in our 20s and early 30s, we reach peak bone mass. And then after that point, everybody starts losing bone, men and women. Now, for women, this is really accelerated because they go through the menopause transition, lose estrogen, and there's a significant acceleration of that bone loss. And then by the time you get into later midlife and later life, women are at greater risk for fracture because they have this lower bone mass. And we know that estrogen plays a role in that, but it's not the whole story. It turns out that inflammation, largely inflammation that comes from the gut, as well as aging associated inflammation, can drive that bone breakdown because the cells in bone, they're called osteoblasts and osteoclasts, they're also derived from immune cell lineages and they respond to those inflammatory signals. So if you have this greater inflammation, wherever it's coming from, including from the gut, you can get the accelerated bone loss. And that's where we're looking to intervene. Can we sort of restore that gut ecosystem, restore that balance, reduce the inflammation, reduce the bone breakdown, and sort of prolong wellness for bone and for other conditions?
Ask my allergist, my allergist, yeah.